Right now, the virus that causes COVID-19 is raging like a wildfire. One person with the virus in a community can allow that wildfire to strike up again, even where the virus is largely under control right now. We still have new cases every single day. What a simple intervention a mask is to be able to put that fire out before it can really even get started.
Wearing a mask is a barrier for us to have our respiratory droplets stay within a barrier as it would spray out with speech, coughing, or sneezing.
If you're wearing a mask and you have a candle lit and you try to blow out that candle, if it's a good mask, you won't be able to blow out that candle.
This virus in particular has an affinity for staying on even small respiratory droplets. So it's really important for us to think about putting our mask on to cover our nose and our mouth with a good fit and allow that barrier to try to hold as much of the respiratory droplets to prevent those from spraying out as much as possible.
PPE we know works. We use much more aggressive PPE for patients that we know have COVID. Face shields, bouffants for our hair, gowns, gloves. With all of that PPE, I feel confident that I will not get COVID if I know how to put it on and take it off well.
When we make rounds, for example, on significantly immunocompromised patients, we will have a mask on to try to help protect those patients from getting the spread of disease and to try to protect other patients from bringing potential pathogens like bacteria and viruses from one room to the next.
All we're doing now is asking for people in the public to use that same logic and have that same compassion for other citizens, that you're willing to endure a little bit of PPE to potentially protect somebody else. The problem with the coronavirus is that after you are infected, usually for about 2 days, you have no symptoms at all. These 2 days are a time period when you are highly, highly infectious. You could potentially infect a lot of people when you don't even know you're infected.
If everyone takes this attitude and embraces the responsibility of something really simple, just wear a mask, just wash your hands, try to stay apart by 6 feet or so in a social distance. If everyone would do this, the chance of transmission would be significantly less.
I know it's tiring and hard to wear a mask at times. When you feel that way, think about healthcare providers that wear a mask all day, every day. They're able to go about their business like usual. And maybe it won't be so hard to just keep it on a little longer. One person at a time, we can protect everyone.